Hello, everyone, and welcome to the webinar this afternoon or this morning, depending on what part of the country you're in. We're excited to have you join us for a provider roundtable on uncovering the hidden impacts of speech recognition. Just as a next slide, please. As a quick introduction to the two companies who are sponsoring today, Envo, powering the healthcare industry with medically infused speech recognition. They're headquartered out in Boulder, Colorado, and they're privately backed provider of SaaS workflow enablement solutions. HIPAA and PCI DSS compliance solutions platform leverages best-in-breed technology to optimize accuracy, availability, and scale within your home health and hospice organization. This cloud-based platform contains a portfolio of speech recognition client applications as well as APIs that are sold into SaaS offerings. We're excited to be partnering with Envo today. Next slide. And from a MatrixCare perspective, whether you know us as Brightree or now as MatrixCare, we're still here innovating for you. The EHR that supports your organization across both clinical and operational. Compatible with iOS and Android devices. Our cloud-based app is used by tens of thousands of home health, hospice, and palliative care organizations to improve the care they deliver. Best-in-class winners for home health for 2 years in a row. And without further ado, I'd like to introduce our first speaker on the next slide. Chris Puglisi, he's our Senior Product Manager of Integration and Interoperability for MatrixCare. He spent the last decade working with our industry and EMRs and focusing most specifically in recent years on interoperability. His strength is enabling technology as well as educating on the growing importance of interoperability and the benefits throughout the healthcare continuum. In just a short time, he's become a leader in this space and is a very driven aspect of our product team. He does have industry roles, including a leadership team member on the post-acute interoperability work group, a technical lead for the functional status subgroup initiative, developing FHIR profiles for functional status, and then he also sits on the Commonwealth Health Alliance use case committee and specification work group. Without further ado, Chris, I'd like to turn it over to you for an introduction into speech recognition.
Thanks, Melissa. And welcome everyone to the webinar today. I appreciate you all joining and hearing us talk about this important subject. This first section, for anyone who's joined some of our previous webinars, is going to just recap some areas of focus just to set the stage for the panel discussion. If this is new to you, however, by all means, jump in, ask questions in the question panel, and we'll get to those during the roundtable discussion as well as the Q&A at the very end. So let's talk about post-acute technology gaps. We all know they're there. A lot of times post-acute gets left out of the big technological innovations we see in the acute and ambulatory space for lots of reasons. Funding may be the biggest one. There's been a lot of, if you look at interoperability, for example, funding made available to providers to implement interoperable standards, and you don't see that necessarily making its way all the way down to post-acute, which is something we'd like to see change and we believe is changing. But when we start talking about technology gaps, it goes beyond just sort of the interoperability stuff you hear all about. It's some of the core day-to-day operational technology that is commonplace in acute and ambulatory settings. And one of the biggest ones that we can highlight is speech-to-text. So there are lots of speech-to-text solutions out there, but none of them are really geared toward, designed for, or intended for post-acute providers, non-physician providers, as well as the physicians and nurse practitioners that serve, in the post-acute setting as well. Next slide, please. And so when we start talking about speech-to-text, at its core, when you're looking at value it can add, the most important is how it enhances the narrative. So healthcare is becoming more data-driven. You hear about it every day. There's webinars about it, like this one. But at the end of the day, there is a certain amount of what I know the Envo team calls, and I'm going to adopt here, but human intelligence, where no matter how granular and detailed and coded you get certain data points, at the end of the day, one of the most important components of a patient record or an assessment is going to be the narrative observation of the given provider or clinician that's seeing the patient. And That is not going to change, no matter, again, how data-driven, how much analytic solutions are out there, how many advanced AI tools we can provide in the marketplace. The narrative, that description of a patient that a clinician is providing in the field is going to still be paramount. The problem with narrative, of course, is that though they take time to enter. And so a lot of times what we see when we have manual entry, even narrative boxes that could hold thousands of characters, maybe you're only getting a couple hundred in there. And as we've looked at speech to text and rolled out speech to text to our client base, we started collecting information. And one of the most telling statistics we found very early is that when speech to text is being used to conduct narratives or to construct a narrative note, the length of the narrative note increases 3 to 4 times. And why is that significant? Well, plain and simple is you're getting a richer, more clinically focused narrative that gives you a better profile of the patient. So any other providers, any other care team members that end up seeing that information, they have a much richer profile of that patient organization or patient and their condition. Next slide, please. Now, as noted, without that kind of technology to speed things along, if you wanted to capture a narrative as rich as one that you can do with speech to text, it's going to take time. And we've already got a very stretched workforce in post-acute care. A lot of folks working overtime, a lot of folks working extra time, and factor in the additional stress here in that for the organization, in that the labor market itself is also very stretched. So you can't afford to keep rehiring clinicians because every couple of months you have a new round of them that are burned out. But you also want them to be able to provide top quality clinical information, and herein lies the balance. So if you've got an efficient method of entering this key narrative information, this human intelligence that needs to be part of every patient record, you need a tool that's going to allow your clinicians to do that in a way that isn't going to have them working in the evenings, working on the weekends, taking away from their family time, their recharge time, preventing that all important burnout that creates problems for you as an organization when it comes to filling your employee roles out and having the resources to see all the patients that need care. Next slide, please. Another component of speech to text another component that speech to text can start to solve is engaging with the patient. So going back to what we were talking about in the last slide, if you want to build a robust narrative, a strong narrative that gives a really, really accurate and thorough profile of the patient's condition, it takes time. And you can't really sit for half an hour and type out 6 or 7 paragraphs of dense clinical information while the patient is just sitting there right in front of you and you silently tap away on your keyboard or your screen. However, if you have a speech recognition tool, you'd be able to hold conversations, maintain that engagement with the patient while you're documenting. And if you talk to most of you clinicians, and I certainly am not one, but we'll hear more from our teams a little bit later in the panel discussion. But that engagement level in a lot of ways is why clinicians get into the post-acute world, so they can have that kind of connection with their patients in their own homes in a place where everyone's comfortable. And that gets taken away from by technology in some cases, where if someone's heads down trying to document on a laptop or a tablet and they can't look up and make a connection with somebody, it takes away from the overall patient experience. So having a good tool can really help establish that relationship without sacrificing clinical accuracy or that work-life balance in the previous slide. Next slide, please. Now, I come to this last one at the end of these because it is the easiest to quantify, but it may not even be the most important. So we know, for example, that using speech-to-text technology is more efficient, right? People can speak 50% faster than they can type. But it's all those upstream impacts. So you've got a more efficient process, yes, but you've also got a better narrative note. You've also got patients that feel more engaged by their visiting clinicians. And you've got clinicians that don't feel quite as strained and stretched out because they can get a lot of their work done in a shorter amount of time. So really, this is almost this is the measurable ROI, but it's probably the least important, right? You can quickly document, and that means your patients or your clinician is spending less time doing that. But it's what results out of that easier method, more engaged method of documenting that's really important. So to summarize or to conclude here before we move into the broader panel discussion, there are lots of measurable and less measurable ROIs when it comes to speech to text. They're all very important, and they're all part of a broader mission that all providers and vendors should have, which is making clinicians' lives easier and making it easier for them to engage with patients. And I think it's very clear that speech to text tools, like one that Envo supports, focused on post-acute care, have an important role in the expansion of services and coverage for post-acute providers. And with that, I will bring on the panel, or I guess turn it back over to Melissa to bring on the panel.
Thank you, Chris. And it's interesting. I know there was a study several years ago that talks about, the degradation of documentation accuracy versus the time lapsed from the time it's documented. So 93% accuracy at the point of care, whereas 4 hours later, it drops down to 63%. So I think that's another great added benefit to using speech recognition or speech to text, because it does allow that on-site, at the bedside documentation. So thank you for that presentation. And I would love to introduce our fabulous panel today. I think, yes. So what we'll go in order from left to right. If you guys can just take a few minutes and tell us a bit about yourself and your organization, and then we'll get started with the questions. So Jesse, we'll start with you. And ignore the names on the photos, because we do have some confusion happening. We're playing a matching game.
Right.
See who matches their name.
So I am Jesse Clanton. I'm a Chief Compliance Officer for Hospice and Palliative Care of Iredell County. We're a medium-sized hospice and palliative care organization in central North Carolina. We have a hospice census of about 230 and a palliative care census of about 400 patients right now. And we've been using the Envo for several months now.
Excellent. Thanks, Jesse. Tiffany?
Oh.
I think you're on mute, Tiffany.
Sorry.
That's okay.
Now better?
Yes.
All right, perfect. Hey, I'm Tiffany. I'm the systems administrator for Mosaic Life Care, home health and hospice. And we are a hospital-based organization. So our home health and hospice, we have a bigger hospital. We have 3 hospitals and about 40 clinics. And I'll let Cassie tell you about how much our census is.
Oh, thanks. Tiffany stole my thunder. Anyway, no, I'm Cassie. I'm the director of our hospice and palliative care for Mosaic Life Care Systems. We do have 3 different branches for the hospice area that our average daily census between the 3 runs about 140 up to sometimes 150. We have an inpatient palliative care unit or team that serves all of our 300-bed hospital system, as well as an outpatient serious illness management team, and then an outpatient oncology palliative care team. Currently, we use MatrixCare for our hospice and home health platform, but not for our palliative care platform for EMRs.
Awesome. Thank you. Thanks all of you, and welcome to the panel today. Chris, I think you might be able to give us just a little scope of other customers that might be on this platform as well within the customer base.
Yeah, so Melissa introduced me already, but again, Chris Puglisi, Senior Product Manager here at MatrixCare over integration and interoperability. And specifically, I've been spearheading this project we've been working together with Envo. And one of the things that we did as we were looking to address this gap was poll all of our customers. And I have a feeling Cassie and Jesse may remember seeing that from about a year or 2 ago when we sent it out. And we got a resounding response from organizations of all types, so home health, hospice, palliative. This is something that we want. And that's in the early release of this and subsequent onboarding of customers, it really is a wide swath of organizations that are participating. And that's kind of an important thing that I think we'll certainly unpack more in this roundtable discussion coming up here. But this is technology that everyone should have access to. It shouldn't be limited to nurse practitioners or physicians. It should be for the in-home clinicians. It should be for anybody who's having that patient engagement should have the opportunity to use this advanced technology. And we're seeing that, I should add, as organizations move to bring more of their team members live on this technology.
Awesome. So before we get started, let's talk a little bit about why, from a technology standpoint, that speech recognition should be a part of it. Let's touch a little bit on, the innovation within the industry, providing that for the customers, and then also touch on security around it.
Are you referring to me specifically here?
Yes.
Just making sure. Okay. Okay, so I set the stakes pretty well, I think, in the first couple slides, where it isn't that speech to text, whether or not it finds a home in post-acute care. It absolutely does, and I think broadly you could say that a speech to text technology belongs in every level of healthcare for lots of reasons. I mean, one of the biggest is you've got complex terminology and you've got a need for accuracy. And I don't know about you guys, but it doesn't matter how good you get at spelling things, you're going to come across some new medication name, and it's not going to render out when you try it. You're going to try and type it out, and you're going to get lost real quick. So when you look at the broader space, the technology is advanced to the point now where it is very accurate. It does what it needs to do, and it's been tested in clinical environments. I mean, I think the most common area to find it in acute and ambulatory settings is in like radiology departments. So it's a tested technology, but for too long, and this is really the hurdle, it's more of a cultural hurdle than it is a technology hurdle. For too long, post-acute gets sort of left out. Oh, they don't need that stuff, right? It's just the nurses going out into the field. It's just they're just doing some advanced care planning. That NP is just going out and doing some advanced care planning. They don't need any, advanced technology here. They're just going to type it out. But the needs in post-acute are the same as they are in these other care settings. The only difference is that the focus has never been on post-acute, and so we miss out on the technology aspect. Now, another reason we know that post-acute and post-acute clinicians are looking and ready for this kind of technology. If you have a tablet-based app like we do, we run into very often folks that are using Siri or Google Assistant or XYZ other recognition platform, consumer recognition platform to try and document. Now, there's all sorts of reasons why that's a problem. The biggest one is it's not HIPAA compliant, which the good folks at Envo have a HIPAA compliant solution to ensure that all that information is being protected and used appropriately, where you don't have that guarantee when you're sending it off to one of these massive consumer organizations like a Google, like an Apple. The second is, I don't know about you guys, but Siri definitely does not get my name right ever. And it never gets a bunch of other words because I talk kind of fast, and I've lived enough places in my life that my accent is all over the place. Whereas a true speech to text technology, like the one Envo supports, has a clinical dictionary, a medical dictionary associated with its recognition tool set. So when you're speaking into it, it's matching up with clinical terms, not commonly used things that people are yelling at Siri, which, as we all know, people yell a lot of stuff at Siri, right? And then the other component to that is when you're rendering that narrative, with a non-healthcare focused app, it's just never going to pick up the words, right? That's the roundabout way I was trying to get to. You're just never going to get those words picked up. So the technology is ready for post-acute. We know post-acute is looking for it because we've already got the stresses I mentioned before around the workforce, around work-life balance, around patient engagement. Those are already there. And then we also know that people are trying to use this stuff anyway, even though they shouldn't, because it's not compliant, not really effective, XYZ other scenario. It all sets the table for a big opening for innovation, And Envo is leading edge on that. With certainly MatrixCare wants to bring that kind of innovation to our customers. And I think it's hard to argue against the idea that post-acute kind of needs this technology to support all their field clinicians. And their restricted labor force, right? You need your clinicians to feel like they're being taken care of, and technology is one of the ways you can do that. I know I rambled away through a lot of there, so
No,
I
that's
open up
okay.
anyone else in the panel to jump in and comment or add anything else too.
Well, we'll just jump into the questions. How about that? So we'll start with Mosaic. Tell us about the key challenges that you're facing across patient care with your clinicians or your business.
Well, I'll start, Tiffany. Thanks. I do think that it's important as we see, we're in a very rural area. So a lot of that is making sure that our clinicians do have the data set that they need and that technology does work. So why, as Chris said earlier, when providing that technology, it's really got to make it work for all areas, all geographical areas, and not just those urban areas, because we do serve some urban areas as well. So to us, one of the key challenges for us just in general is making sure our technology works in the rural area, which that's why MatrixCare fit our bill, is because we could use the iPad with the data and put it on Wi-Fi, etc. So that's a good way that the speech to text will help our clinicians be more efficient in trying to get out of those rural areas a little bit quicker into where they can get a hold of the office, where I know there's areas that they have to call the office and say, hey, if you need to get a hold of me, it's going to be an hour. So this also helps them speed up their not take away from the patient care while they're speeding it up as well, but speeding up that visit and keeping that in touch. So I do think that's one challenge we face, and where that this technology helps us answer that problem.
Need.
Yeah.
All right. Excellent. Tiffany, do you have anything to add to that as the administrator from a technology standpoint? How, what kind of challenges you guys have been facing?
Another challenge we've been facing is just providing the correct tools for our clinicians out in the field. And I really believe that this speech recognition really does help them. iPads are great, but when you go from having a laptop out in the field to an iPad and you have to push on it if you don't have a keyboard, some of our clinicians find that very hard, and it takes a long time to document. So that's another area that we have key challenges in, is just finding the correct tools at the right time for our clinicians.
And just to add on to that, though, you talk about that narrative note. I think that due to having some of that lack of technological IQ, it is hard to type all of that out in the iPad at times. I will tell you, I love to use my iPhone, but to give me that iPad and try to type something on it, I'm not very fast at it. So they give up, and like you had pointed out earlier, the efficiencies of it and the effectiveness of that, you get a better clinical note, which then when state comes, they can look at that note and be like, wow, you really know your patient. We actually did have state look at a couple patients who we were trialing the Envo at the time, and they were pretty impressed by what they saw. So
It's an excellent point, especially as those organizations come in to check on everything we've got going on in this industry, right? Jesse, do you have anything to add to that? What had you and your organization considering speech recognition?
So we started with in 2017, and so we originally.
I think you have a bad connection, Jesse. Maybe if you just do audio. Okay, well, while we wait for him to get his connection cleared up.
Can you hear me okay?
Oh, yeah, I can hear you. Maybe just turn off your video and that'll help.
Okay. All right. So we started with Brightree in 2017, and originally started with the iPads, and the team here was using Siri or the dictation on the iPads, which we had to stop that practice because that's not a HIPAA compliant method. So when this came along, this was great. Everybody's used to using that functionality on the iPad, on the iPhone. We're used to using that. So it was frustrating to have these Apple devices in the field and not have the ability to dictate that note, which makes that whole process of typing a narrative much quicker. And like Chris said, you get about 40% more in a narrative note when you have somebody speaking it versus typing it out. And you'll also see the vocabulary tend to increase, the complexity of the note increase. Nobody's going to attempt to document Czechoslovakia in their note, but they'll dictate it, no problem. So, it improves a lot of the documentation.
Excellent point. Thank you so much for that.
I do want to just make sure to call out something Jesse brought up there, which is we do live in this world where people expect stuff, and that includes your nurses. And so bringing the technology that they're already familiar with, it's almost a no-brainer, right?
Well, I think you see that you watch physicians use this technology all the time in the inpatient world in the acute care setting, and nursing isn't even there yet in the acute care setting. So I really think this piece of technology for post-acute is on the cutting edge, and we probably being in post-acute, it's going to be a driver also for nurses wanting to come and work for us, or clinical staff in general, because chaplains and social workers can all use it. But so it really also helps with that in my mind, because I've always wondered, why is it that a physician gets to dictate and I as a nurse can't dictate my notes? So
I think we've heard that many times. That's a great point, Kathy. And with that, could you speak a little bit to how your clinicians feel about it, like from a satisfaction standpoint?
Overall, for the most part, and Tiffany can chime in at any point here, they do enjoy it. It's taken them a little bit to get used to, because you kind of have to wait until you're done dictating for the note to populate. But once they've gotten used to it, and then the speech to text recognition, I have one nurse who has a very Southern accent, so we really had to teach her to go back and read your note. Please read your note. And so she had to really take the time to get used to it. But once they've got it, I do feel like their notes are more thorough. It does show that decline more efficiently and effectively than just charting to boxes and click boxes. It doesn't decrease the double charting necessarily, but yet it makes them feel better that they did get to double chart, but yet it's done in half the time that it would do to have them type that all out and click it all out. So
I would imagine.
Anything?
Yeah, I do. We have many different generations of caregivers using the speech recognition tool, and they've all said that they like it. It's so much faster than typing, and one of my favorite comments was it's better than Siri. So it's recognizing what they're saying, it's picking up what they're saying, it's picking up that medical terminology, that verbiage, it's spelling those really hard words for them. I even had a caregiver come up to me today to tell me she said, it knew how to spell to be grip. And I'm like, well, that's great. I don't even know what to say to that, but that's awesome. So I really enjoy it. I really like it.
Does Tiffany know how to spell to be grip?
We probably shouldn't go there. I use a computer to do that.
Well, as one of those people who has a Southern accent, I can appreciate that for sure. Also, I'm thinking it might
on that actually, Melissa. So one of our engineers who built the functionality is Scottish, and Scottish accents are famously bad at speech recognition. And there is a learning curve, as Cassie mentioned, but what learns right along with you is the technology. So one of the amazing things about what Envo supports is a learning algorithm. So as you use it, you'll get used to how you speak, which is a real advantage, especially in, parts where I'm at, parts across the pond, where the accents get, you could question whether or not there's an all English going on there.
You can definitely tell though from her accent just how much better it got from the beginning to the very end, or as we're using it, how much it recognizes, and there are less errors in there now than in the beginning, because I'm like, what are you saying in this note? So that was really interesting to watch and see it proceed like that. So
we had some similar issues, as you can imagine, but it's not just one of our practitioners, it's all of us. But it did continue to improve over time, and it's about 98 to 99% accurate most of the time, and does well with the terminology. But yeah, Envo said the southeastern accent is one of the harder ones to pin down, but it's doing quite well.
It seems like, and maybe Cassie, you can speak to this, it seems like it would also reduce the time of having to come back to ask the clinicians what's happening, because it is a more thorough note.
You're exactly right. I can actually read the note and feel like I'm right there with them. I know that one clinician has learned to use it with the patient so that they know what she's saying, and they don't have to say, the patient doesn't have to say, show me what you're writing about me on the internet. They can definitely sit there and hear it, but then we get a clearer patient rather than having to go all the way through. If I don't want to do a complete chart audit, I just want to read the narrative. I get that done very quickly, and it's very thorough, and they've painted that picture, which is what CMS and Medicare really want you to do to prove that that patient deserves to stay on your hospice service, is to paint that picture. And so you can really do that with the speech to text, because you see the patient right there. You don't have to come up with those words as you're typing them. You may have to change a few while you're in there, but you can really definitely paint a better picture versus typing it out, because like Chris said, it takes you longer to type it out. Well, by then I've lost the words. I mean, some days I don't know what my name is. So if I can talk to you, I can tell you, but to type it out, I'm not going to remember. So.
Excellent. Thank you so much for that. So what benefits have you observed? I mean, I feel like it's touching each of the different aspects of your business, right? Because if there's a more thorough note, QA is doing better, as we just said. And then also as your billing team is submitting the billing, then they also have a more thorough record to submit. So talk a little bit about that, how it's touching each of your different aspects of your business.
Oh, I can do that, Cassie. I got you. So we're having less rework for our clinicians. Our narratives are definitely more, they're more detailed. There's less back and forth between our caregivers out in the field and our coders. And we just have a better continuity of care. And they really like it. So do you have anything to add to that, Cassie?
No, I see that, like, Jesse is the quality and compliance officer, so he could probably answer the compliance part a little bit better than we can as far as the talk to text goes. Like I said, we wanted to do it for Mosaic, really for that work-life balance for the clinicians, so that their charting is done less than that 48 hours that we require. That's probably the biggest compliance piece, but other than that, it was really the work-life balance and giving them the tools that they needed out in the field. So Jesse, if you have something to add from a compliance standpoint, that's really our main compliance reason. So
Sure. The big thing was for us is this was something that was requested to just make the provider's life easy. They're the main group that's using it right now. Providers and admission nurses. The big thing is just having that detailed clinical narrative that helps support terminality, or if you're doing a face-to-face, the better detail I can get in that note, the more I can support that patient get on service. So from a compliance standpoint, from a quality perspective, when it comes to audit time, that's what you've got to be able to ultimately prove. So if you've got a tool that helps you show that this patient is better, and if you enabled your staff to do that by being able to talk into the device rather type it and that helps you get a richer clinical note, then I'm all for it. So that's what that's what we're trying to use this Envo system to do.
Excellent. Thank you so much. That's a great point, Jesse. But I see several questions coming in from the audience. So before we switch over to those, having experienced speech recognition within your organizations, what would you share with those on the call as to best steps to move forward, or would you recommend it, that sort of thing? And is there anything that you might see from your vision perspective for further deployment or implementation?
I would definitely recommend it. I would say roll it out one group at a time. Find who's going to need it the most, who's going to use it the most. And it's a great tool, but it is one of those things you kind of have to follow, or staff's going to fall back into their more comfortable level. So they may forget about it. They may not use it to the fullest potential. So it is one of those things. Start with one group, get early adoption, build a little bit of buzz around it, follow them, and continue to push it. If you have good success with one group in the organization first, that's going to help it to spread, and it'll improve the adoption as you look to, if you want to implement across disciplines, that'll help your case.
Excellent. Thank you. Mosaic?
I agree with Jesse. Honestly, find the caregivers that are going to use it and let them champion it. And honestly, it is just that. It's another tool for your toolbox that MatrixCare provides that I probably, and I think I speak for Tiffany too, we wouldn't make everybody do it if they didn't want to do it. It's really just for those who really are better at that. You know, we have to, as leaders, be multi-generational at this point. We're leading so many different generations right now. So really what works for them, their work-life balance, what makes them happy and want to stay with your organization. So it's definitely a great tool for the toolbox. You know, it'd be something that if you could hook me up on the AFO side, thanks, I would like that. So, you know, that's my advice for those out there listening.
I think that's an excellent point, Cassie, because this allows you flexibility with your different generations within your employee base. So that's a great point to highlight. So we'll switch over to a couple of the questions that are coming in from the audience. Are there any concerns from you guys as organizations with HIPAA and using cloud services to transcribe speech to text?
No, not with this, because Invoke has a completely HIPAA compliant system. You know, I think it's quite secure. That was why the Apple servers are not secure. That's why I had our organization stop using that as an option. But I am, you know, I've reviewed the HIPAA compliance with Invoke, and they're compliant with everything that 45 CFR requires.
Excellent. So how well does this system work with direct care staff, people who may not have a nursing degree, for example?
So I don't think it's dependent on your discipline or level of expertise. I mean, it's a very accurate system, like I mentioned earlier. Even with the folks we have using it, still 98 to 99% accurate.
I agree. I don't think it matters what, you know, your clinician, what discipline they come from. It's easy to use on all levels. It's a simple talk to text. Again, it's like using Siri, but better, Siri on steroids. So it's made for the clinicians, and so it understands what they're trying to say. You know, me trying to tell somebody I need an 18 French Coude catheter into Siri, they're not going to get it. But this program will. So it doesn't matter if you're a social worker, chaplain, it works for all disciplines.
I think that's the quote of the day, Siri on steroids. We're going to have to use that moving forward.
Medical steroids. We want to be medical.
Right. Well, and speech recognition would pick that up, so that's good. How are you capturing the recording? Do staff use a script? So that's a two-part question. Chris,
No, we're not using a script.
Okay.
Then we're just, it's the same as if you were in the field documenting a narrative note. Instead of typing it on the iPad or on the keyboard that you have, you're just going to be speaking that note into the system. So anything that wasn't captured in the visit or the assessment that you were doing after you've gone through your check boxes when you're going to add your narrative note, it's the same. Anything that you're going to be typing in, you just swap that out for speaking it directly to the system.
Yeah, so I just add on to that, speaking of some of the technology that Envo supports that organizations have the option to implement. So first up, when we think about speech recognition in consumer scenarios, right, you're just going to run through whatever you want to say to Siri or Google Assistant. But Envo, it really is for the administrative and clinical capture of information. And so you can do, while you're talking, bullet points, numbering, as part of what the speech to text part generates. But on top of that, all the way down to the individual user level. So it can be by the organization, it could be by a certain location, it could be by a user. You can also have custom forms and templates that you say, Envoke load my standard terminal illness template. And it'll load a terminal illness template into the narrative that then you could add to that's patient specific. So there's opportunities to balance, going back to the question specifically, there's opportunities to balance both, it's misnomer because we're talking about speech to text, but freehand entry with structured forms where you have a structured set of text that you load, and then you can add freehand to it as needed. But this is all customizable, so you can build this as you need it for your organization.
And Chris, while I have you, I think part of this question is how are you capturing the recording is probably due to it being integrated with your EHR, right? So that's
so just from a technical standpoint, we open the stream audio using the device microphone, and the audio is then streamed to an Envoke endpoint or API location. And this is all happening in real time. So I'm describing these things, and it actually happens faster than I can describe it. So opens up the connection, audio streams, and then moments later, Envoke sends back text. And so as far as the user sees, and I think the team from Mosaic and Jesse from Iredell can attest to this, as far as the user sees, you finish talking, and then a second later, your whole block of text appears in the narrative section. So while it is going to an external part, one of the things that Envoke and MatrixCare work very carefully on is an implementation that makes you feel like you're just doing your narrative note in your EMR like you would if you were typing it out or following any other process. And that's important because it's one thing to have speech to text, it's another thing to have speech to text embedded into workflows. And that's where we continue to elaborate, grow, and expand our work with Envoke, and looking forward to sharing with our implementers more technology as we roll it out related to this.
excellent. Thank you. So another question, and I think we have touched on it, but let's just re-emphasize it. Do your clinicians use speech to text at the point of care? Is there any input from the patient or caregivers, and do they enter their medications with it as well? That's a three-part question. Let's start with the beginning. Do your clinicians use speech to text at the point of care?
Some of our clinicians.
Okay, some of yours do at Mosaic. Jesse, I think you were about to chime in too.
Yeah, I was going to say it's dependent on the patient, it's dependent on the provider, where their level of comfort is, and you just have to gauge that situation. It's very possible.
And I always think it's a good idea to encourage it. We encourage that because then the patient knows what you're saying about them. There are going to be those occasional situations that you really have to go think about with dynamics, of course. But if it's just a routine visit, it just helps ease the patient's mind a little bit about that we're really not talking bad about you. This is what we're charting about you in your situation. So, you know, like I said, for the most part, we really do try to encourage it, just like we would encourage bedside charting, point of care charting.
I think that's a great point, and especially in today's world, transparency is so important with patients and the family. So thank you for that point. And then the next part of their question was any input from the patients or caregivers as well. It seems like this would be more of a clinical note, so.
Right now, I mean, I don't think that we've gotten any negative comments. I will tell you nothing's came through on patient satisfaction. Tiffany and I have not gotten any phone calls. Clinicians have not reported that patients have been upset by it. Again, I think because we're completely transparent about it when we do at the bedside, that they're appreciative of that. And especially if that's one thing that personally I learned as a clinician out in the field before coming to the office, is that they like that transparency. And you know, the first person that was like, are you putting that on the internet about me? No. So if you can show that to them, that listen, everything I said here is going in the chart. This is what you're going to read if you were to ask me to print it off. So.
And Melissa, I'll go ahead and field the last question because I think it's an area that's of interest to MatrixCare. So when we talk about, like I think the question alluded to profiling meds. So currently not supported, but that is a very, very logical area to move to, right? Because that is a process now that unless you have some import opportunity either from the referral source or from another source, med reconciliation is manual, right? So if you could just open up a dialog box and just start reading off the bottle and have that convert into your patient's profile, that's a huge opportunity. And we wouldn't want to stop there because there's lots of parts of documenting in a chart that are just like that. Think about entering vital signs, where you're collecting all these readings, and then you're going into little boxes in your EMR and typing in whatever the reading is. And I don't know if there's an EMR anywhere that's gotten away from having 5 little boxes, one for each different type of vital capture. So if you could just say, O2 sat, blood pressure, XYZ other thing, and just say each one of them in numbers and have that populate in, another opportunity. Wound care, same thing. Documentation of wound care and having that populate into forms. There's endless opportunities once you have a strong baseline and a group of users that are used to it. And then we can really look to innovate and expand and evolve, not just what MatrixCare is doing, what our users are doing, but the marketplace broadly. If that's what's expected, and it should be, you'll see other technology providers jumping in to join to support providers, which is the end goal here for everybody, right? Is supporting providers.
Very, very good point, Chris. Thank you so much for that. This question is, can it be used to indicate check marks? I'm not exactly sure, but maybe one of you knows what that means.
So I'm going to have to say I'm not 100% about specifically check marks and check boxes. As I know, there is way you can structure the syntax using commands while you're talking to the voice recognition tool. So you can add bullet points. I'm not 100% sure about the check boxes, but certainly something we can follow up on. So if you leave your contact, we can get that answer for you.
Excellent. Thanks, Chris. Okay, and then we are looking to implement speech to text within the next month into our home-based environment. Outside of picking our champions, what other advice do you guys have for a smooth implementation process?
What we found here at Mosaic is there's a lot of education that Envo provides and MatrixCare provides on how to actually use speech to text, especially when you're dictating medical terms and those types of things. Be really, really patient with everybody. They need to give it a while before they're just like, I don't like it. You have to be really, really patient. And continued sessions of education moving forward, because you may have went over how to do bullet points or make sure you say period, those types of things. But coming back to those key education elements and then moving forward on other things, like whenever you're dictating a blood pressure and you put that in your narrative, you don't want to just say BP, you could actually say blood pressure. But there's a lot of Invoke education that we used and MatrixCare education that we used, and just actually provider dictation education that we used as well.
And to add on to that, I think that you find your champions of, you find your few, and you start out just like Jesse had said earlier, in groups. Find your champions who, really get good at using it and go live with them first, and then add on as people get better. So then they always have that peer-to-peer support system. And Tiffany's done a great job with our staff, but they look to each other a lot when they're out in the field, because they're like, oh, we don't want to bother anybody. So really just having that peer structure to where you're teaching the user, and you continue to teach each other. So along with that education that Tiffany would provide, that Invoke and MatrixCare provides.
Yeah, I agree with all that. I would say training is key. Have these, the folks speak with MatrixCare, review the material from Invoke, review the material from MatrixCare, and then just go over a few things. It's not super difficult, but you do want to make sure that you enunciate well and speak clearly. And there are, a couple of little tricks to the system that will improve the overall success and improve the adoption of the system. So I'd say work with that team to make sure your initial users have the most success.
Great, thank you for those other recommendations. I think the provider asking the question says thank you. So, Chris, I was wondering too, I think that this you can go through a speech recognition platform outside of your EHR as well, right? You're on mute.
I mentioned earlier, there's certain inherent advantages of embedded technology, but Envoke, does support access to their platform outside of a direct integration with an EHR. So certainly, while we focus on embedding in workflows, there are other opportunities with other EHRs to use Envoke, just outside of an embedded scenario. So lots of, I want to make sure everyone on the call who may not be using MatrixCare yet or is considering speech to text, know you have opportunities with these technologies that don't necessarily rely on your EMR having the same kind of commitment to this technology that MatrixCare has.
Excellent. And I think, what we've heard today is great information. And then also, as we look forward through value-based programs and, added compliance and regulatory requirements, that we're going to need more and more technologies like this within our space in order to help us meet those requirements, but also be able to meet our referral sources as well, their needs. So next slide, please. Next slide, sorry. Just in closing, I wanted to leave up some contact information for both MatrixCare and Invoke, and also send a gratitude out to our panelists for joining us today. Thank you for taking time out of your day to share your experiences with our audience, as well as Chris. And we hope you guys have a great day, and we look forward to seeing you on our next webinar.